Right, so I also use a handheld percussor, which is a vibration device that varies from, what did we figure, 3 hertz to about 10 hertz. That's the range. It's a handheld device. And it's been used by chiropractors for many years.
Physical therapists.
And physical therapists. And I remember the first time I was exposed to one of those was in 1979. By a chiropractor that was using it, and it felt good, but I knew that there was something missing in the therapeutic range. And it turns out that now I know in hindsight that that percussor was really not a true percussor. It had a circular motion to it more than it had a percussive motion. And I think I've always been really interested in just the straight, what would be called vertical percussion for therapy. And so there is a couple of companies put out handheld percussors that I've used, and the effect that it has in clearing the lungs, mobilizing GI function, releasing muscles, has been really significant, and patients love it. So it's also really good at moving the lymph system. So I saw the value of the handheld device and continue to use it for fluid movement and neurological balancing.
When you say neurological balancing, are you talking about chemical or physical? Or
well, it would be like sympathetic, parasympathetic
okay.
Balancing, and you can have, like where the nerve roots exit the spine. If they're not sending the signal from the spinal cord and brain out, you will see a weakness of related muscles. And the percussor and both the laser more so really are phenomenal at igniting that spark and restoring the communication. So the percussor also does that as well. So that's one of the ways of affecting the neurology. Also, it's very effective on the sacrum and the occiput to mobilize cerebral spinal fluid, which helps bathe the brain and the spinal cord, as well as the peripheral nerves, which is actually continuous with the sleeve around muscles and around the organs. So.